everyone. My name is Julianne Meyer, and I am the host of Own Your Wellness. And I'm excited to be here today because I have a new future friend on the show. We haven't met yet in person, but we will be meeting soon. So I'm really excited to introduce her. Her name is Erin Allen. Let's bring her on.
Hi.
Hello. Good afternoon. How are you?
I'm great. How are you?
Good. So good to see you. So why don't you tell us a bit about yourself and your own wellness journey?
Well, I am a family nurse practitioner. I own a private practice in Denver and Colorado Springs, Colorado. My journey to wellness has been long and complicated.
Sounds normal.
I think for most people, it's long and complicated and hard to navigate with our current healthcare system the way it is. And so, part of what I try and do for my patients is to, one, help them navigate the healthcare system in a much more effective way, but also to really listen to what it is that they're trying to achieve with their own wellness and with their own health, and maybe not necessarily what my goals are for them, but what are their goals. And so we want to do all of the basics, and we want to make sure that blood pressure is good, and that cholesterol is fine and thyroid is correct, and all of those wonderful things that we do in primary care. But I really want to help patients and clients get to a point where they are comfortable in their own wellness journey. And so, with all the struggles I've had of my own, and all of the issues I've had within the healthcare system, my goal is to really break out of that and help patients to move forward on their own wellness journey.
I find that absolutely amazing because on this show, I'm always talking about, and I always have to premise this, there's nothing wrong with Western medicine. I'm not putting, that down. However, I just feel like there's this huge piece missing. And usually what that piece has been for me in particular, and my clients that I work with, is that it's like you don't get heard.
Right. So we're all very used to the standard 5-minute visit with their primary care provider, right? What do? You go in once a year, you get some very basic blood work done. A nurse, well, I shouldn't even say nurse, it's usually a medical assistant. They are not nurses. There's a different thing. Don't get me on a soapbox about that one, but they're all wonderful, but we have different jobs. An MA will see you for 10 minutes and take your vital signs and ask you a bunch of questions. And then your PCP will come in for maybe 3 minutes and say, what do you need? Oh, your blood pressure is high. Here's your lisinopril, and I'll see you next year. And that is all you get. And, frustrating part to me is that's not primary care. Primary care means preventive care. That's what primary care is, right? So, and what we're used to in this country is primary care is more sort of band-aided urgent care, in and out. Let's do the bare minimum and make sure everybody's healthy on paper.
Exactly. Yeah. And that actually, this is kind of veering off of where I was intending to go, but I'm curious what your thoughts are about this one. So, for example, there's always those normal range of whatever. It could be, for me, it would be like iron in my blood.
Sure.
And just because it might be, and this isn't my case, but just because it might be in that normal range doesn't mean it's optimal for me. And I am not without symptoms. So what does somebody do when they're not being heard? What can somebody do when they're like, do they even, do you think most people even know that they could ask for like more help or anything?
No, I actually think that most people don't know that. And the people that do know that are very frustrated because they can ask till they're blue in the face, but most healthcare providers, and let me preface this by saying it's not the provider's fault. Okay? Everybody wants to do what's best for the patient. None of us got into a job this hard. So that, so that we could not help people, right? But they're limited by time. They're limited by what the insurance company says that they can do for a patient.
Yes.
Right? They're limited by the overarching big healthcare management that says you must see 25 to 40 patients a day. And so it's not that they don't want to listen to you. It's that they don't have the time. They don't have the resources to follow up, usually.
Yeah.
And it's simply easier to turf you off to somebody else. And so what patients can do is really to look for those providers that are actively trying to change that system, and I'm not the only one out there. I know I'm not even the only one in Denver, right? But look for those providers that are taking time to actually talk to patients, that are taking time to actually review your health history. When you go and make a new patient or client appointment, if the time frame on there isn't at least an hour, you're probably not going to get what you need.
That's a good piece of information. I didn't know that. I mean, it makes sense, but I never thought about it before.
Right.
Obviously, they can't ask enough questions. How are you supposed to answer?
Right, because it really is. It's an interview. When I see a new patient, I'm booking 75 minutes for a new patient, and usually a 15-minute break after. Most of those patients end up being an hour and a half, because we get talking about things that they didn't even write down on their way in. But the more I dig, the more questions I ask, the more information I get, the more curious I am about what's going on. And we're able to really dig at what's the root cause of what's happening here. And you really can't do that in a 5 or 10 or even a 15-minute, if you're lucky, new patient visit. You really have to be able to talk to someone, and not just talk, but actually examine someone. Have the time to actually feel a thyroid, right? To palpate a thyroid, listen to a heart, right? Listen to the lungs they're talking about, really look at their under eyes, and what's going on in their sinuses and their ears and everything in their body. Really do a good thorough exam for a patient, and not just, listen to heart and lungs and go, okay, well, all your labs look fine, I'll talk to you next year.
Exactly.
You can't do it in even 15 minutes.
No, that makes perfect sense to me. I just, I've personally not had the best luck with doctors. I just don't ever feel heard, or they can't figure out what's wrong with me. But I guess part of what I'm curious about for those people out there is my experience. And I don't know, because I lived in New York for over a decade. So I kind of have a little edge to me.
There's nothing wrong with that.
Just a little bit of an edge. It comes out. Anyway, the thing is, if I go to a doctor, because I still need to see, a medical professional from time to time.
Sure.
And if I don't feel like I'm being heard, I want to be able to say something that maybe will get them to listen. And I know that everybody's different, but I want to be able to say something to get them to listen to me without undermining them or making because to me it seems like it's almost like they think I'm challenging their intelligence somehow, and that's not what it is. But you know what? I live here. I live in this body. I'm the expert of it.
Right. Yes, I have. When I see someone new, I've known their body for as long as they've been sitting in front of me. They've known their bodies their entire lives, right?
Exactly. So is there any way, or is it, because I always feel like I'm walking some sort of fine line where it's like, I really need your help, but I also really need you to hear me.
Well, you know what? I think it's a really good practice to say that out loud.
Oh, that makes sense. Yeah, it's pretty simple.
I really need your help with X, whatever it is. But I really need you to hear me when I say whatever else. Okay, yeah. So don't be afraid to say that to your provider. And your provider may say, I really don't have time to go into that today. And that's okay. But at least they heard you. Yeah. You wanted to be heard. And they may say, we can talk about that at a different appointment, et cetera. They're willing to make time at some other point. Okay. But don't ever be afraid to say, I really need you to hear me. Or I'm having this list of symptoms. I know what my labs say. However, right? So it's okay to say that. And it's not challenging. It's just wanting someone to hear and recognize what you're feeling in your own skin.
Exactly.
Right?
Exactly. And I mean, we are our own experts. So people could tell me something and I'll say, nope, that's not it. Like, not so rude, but and I've said things similar to that. I've just had people say, "Oh, it's all in your head." No, it's not. I feel it in my body. It's not. Well, that is my head is my body, but that's not where I'm
that's
doing
the
it.
thing that a lot of people are missing in modern healthcare is that the mind and the body and the spirit are absolutely connected. And you cannot separate one from the other and expect the whole to heal. It's just not how it works.
Exactly. So since you are not the norm for Western medicine, which I adore because you're the best of both worlds. You know, we get like one-stop shopping with you. Just so unusual. At least not that common, I should say. I shouldn't say it's so unusual. But anyway, the point though is that there's, you know, you mentioned that you got to take into account everything. Are there some things that are just basic healthcare ways to take care of yourself that maybe aren't common, like in the Western medicine world? Like, for example, meditation.
Yes, absolutely. So just making time to check in with your body, right? Just taking a minute to sit still, put the phone down, all right? Log off from whatever you're doing. Not right now, we're talking right now, but log off from whatever you're doing, put the phone down, take your shoes off, put both feet on the ground, and take 2 minutes even to sort of do a body mind scan and check in and say, what do I need today? What do I need today? You know, am I hungry? Am I thirsty? Am I dehydrated? Am I tired? Right? Am I edgy for some reason? Am I feeling really down? Right? Taking a second just to recognize those things so that you can be more aware of them during the day. Maybe there's nothing you can do about some of that right now, but even being aware of it is helpful. And that's not just for the mental or behavioral health symptoms, or you know, how you're feeling emotionally. That's also for, okay, well, you know what? For some reason, my lower back really hurts today. I'm going to be conscious of that. Maybe I need to stretch, right? So just feeling what you feel, take a minute, do the inventory, and, you know, what can I do about that right now?
I really like that because I always feel like my body's telling me something. And if I get sick, because I don't typically get sick, but if I do, I feel like it's because I haven't been listening.
Yeah. Yeah.
It's like there's, you know, it like gets louder. I wasn't like, oh, you're not going to hear me today.
Scream at you, right? So it's like, and I'm a mom. I have 2 teenage boys, and they always say, "Mom, why are you yelling at me?" And I'm not much of a yeller. I'm just naturally loud, but I'm not much of a yeller. And I'll say, "Well, because I've already asked you 3 times." Right? I know there are other moms out there or dads that have gone through this. I've already asked you 3 times. Now I'm really adamant about it, right? Your body is the same way, right? Your mouth was a little dry, right? So you're getting dehydrated. So your body's gently telling you, I need to drink some more water, right? And you ignore that. And then you start to get a headache, right? And so your body's telling you a little more nudgingly, I really need you to drink some water. Okay? And then over a few days, you're ignoring it and your skin starts to get like super dry and itchy, right? Or even more so, you develop a urinary tract infection. Right? Or your joints start to hurt, okay? That's down the road. Your body's screaming at you. I am chronically dehydrated here. I need you to get me some fluid. If you would have just checked in and listened when your mouth was dry or when that little headache started coming on, it wouldn't be such a big issue now, would it? Right? Exactly. So we have to listen to our body's warning signs. That's why I say, take the inventory. Am I feeling tired? Am I feeling down? Like, am I edgy for some reason? Does my back hurt? Whatever it is. And just be aware of it so that you can make those corrections early.
You know, you said something that I want to touch on, and you mentioned the word edgy. And I want to say that I was recently diagnosed with something, and one of the symptoms is anger. and it has nothing to do with my mood. So, it was, for me, I thought there was something really wrong with, like, mentally, because I'm like, but it didn't feel like my anger. I had no reason to be angry.
Right.
So, is that kind of like maybe another way that your body is saying, hello, something's off here, something's off?
Yeah, absolutely. Because like I said, the body and the mind and the spirit, your emotions, etc., they are all connected. So if you're feeling really, really on edge about something, maybe you're anxious about something coming up, right? Or maybe your blood sugar's low. Okay. So but you have to recognize that you're feeling a little off to try and figure out which direction to go with that. The main thing is don't ignore it. Right?
Yeah, exactly. So, something that I heard you say too was basically, you're trying, what you think of as healthcare, and I'm with you, is more preventative, as more of, let's stop it before it starts,
Right.
Instead of trying to feed it with a pill after it's happened.
Right.
So, most people know about drinking lots of water and eating more vegetables and, trying to stay away from, I call it food-like substances, but let's call it
are not food, right? The sugar,
exactly. It's not actually food. It might resemble it. But these are all things that we all know. However, most people tend not to do them. What's your take on that? I know everybody's different, but
there's lots of reasons for that. One is convenience.
Yes.
Right. We're all very, very busy. we're all very stressed. We have very tight schedules, and it's sometimes not feasible to cook a real meal with like vegetables and protein. Okay. And it seems easier just to go grab something.
Yeah.
Okay. And then there's also cost. The cost of nutritive food is more than the cost of junk food. It just is. Right? Because the junk food is full of fillers and food-like substances, right? It's there because it's inexpensive. And so, the starches, the high fructose corn syrup, all of those things are heavily subsidized, right, in our country. And so get me on a soapbox about that, Julie. But those things tend to be less expensive than really nutritive, healthy foods. So it's expense, it's time, it's stress, it's our schedules the way they are. It's also comfort.
Yes.
I think for a lot of people, it's very emotional. Even for myself, I can say, are mashed potatoes the best thing for me? No, they're not. But if I've really had a hard day, that just sounds really good to me, right? It's a comfort thing. It's like grandma used to make them that way, or mom used to make them that way, right? And so it's warm and it's comforting. And so we're using it as sort of an emotional Band-Aid. So there's all of these components, and it's not one simple answer. And so what we have to do is dig at what is the answer to that for you, and how do we help you fix it? So, and that's why it's not just me here. I have a health and wellness coach that helps patients to develop better habits and recognize what habits they are kind of doing on a consistent basis, so that they can then be more aware of them and fix the problem more at the source, right? And just like setting up those healthy ways of being, and with a little more accountability. And that's something that providers don't have time to do with a patient. We'd all love to, right?
Yeah, I believe that.
Providers don't have time to do. And so sitting down and mapping out with a health and wellness coach, with the cooperation of your provider, right? That, you have this medical issue, say you're diabetic, let's just say, newly diagnosed diabetic, and what should you be eating now? And what are your habits that got you here? And how do we go back and fix those? And that's something I think that really gets missed usually in primary care. We get the diagnosis and sometimes some meds thrown at you, but not how do we fix it? Can we backtrack? Are these things reversible and treatable?
I think that's really amazing, because that is the piece that's missing. And, I think that's part of the reason why I always want to preface my comments about doctors with, like, it's not because there's only so many hours in the day. There's only so much time that they can give. And you can't expect them to be able to do absolutely everything for you, even though they may want to and have the knowledge, etc. It's just not feasible. So I like that, working with more than one person to get you to your goals.
Right.
Because, I don't know about you, but like for me, sugar is my nemesis. And
it's absolutely my drug of choice. I will tell you.
100%. I call it, there's fruits which I will not limit, but everything else to me is recreational sugar. And I just that's tough. And it's kind of nice when you can work with someone who understands and, can help you see maybe things that you can't see that you're doing. Or, a lot of people think too that once you take out a bad habit, that's enough. You can't leave that void there.
Usually something else creeps in to fill the void, and unless we can actually figure out what's causing the habit. What's the driving force behind that?
Exactly.
Right? Is this because you're seeking comfort? Is this because you're depressed? Is this because you're anxious? Right? Do we need you to talk to one of our counselors?
Oh, I love that.
As opposed to, here's some Lexapro or some Prozac, and follow this diet.
Yeah.
Right?
Yeah.
No, let's talk to one of our mental health professionals that we have here at the practice. Let's get the coach on board, and I'm going to keep monitoring your blood sugar and whatever else is going on, and we're all as a group going to get this together.
I think something too, I was just thinking about this is, when you get, say, a diabetes diagnosis or something along those lines, especially in the beginning, when you're upset, if you're eating for, say, emotional reasons, you might not see the bad result right away. So it seems like,
it seems like you're getting away with it, right?
I think that is something that it's like hard because, we don't necessarily make the correlation in that moment when we're upset, or at least I know that's true for me.
That reminds me of something that I don't even remember which relative it was at this point. I just remember it from a childhood. That it's all fun and games until your pants don't fit, right?
Oh my gosh, I love that.
It's one cupcake, or it's just one cookie, or it's just what, and not to say that you can't still enjoy all of those things in moderation, but really look at, like, why am I reaching for it?
Exactly. And there's such things as like trigger foods too. So for example, my boyfriend Drew and I just got back from his niece's wedding, and they gave us these cute little test tubes of hot chocolate, and he's with the little marshmallows in it and everything. It's super cute. And he was really excited. He's like, let's do this. Let's have one night with hot chocolate. And I said, how about you have hot chocolate and I'll have tea? And it wasn't because, having that one hot chocolate is bad, but that's going to start the phenomenon of craving in me. And it doesn't stop there. So, it's kind of important, I think, too, for people to realize what those trigger things are for them, so that they don't have just one, because it never is just one with certain things. I can have one potato chip and leave it, but sweets, not so much.
No. Yes. And that's right. Like I can have one, I'll preface this by saying I don't have an alcohol issue. I know lots of people who do, so I'm not belittling that whatsoever. Yeah. But it's not unlike being an alcoholic or a drug addict. Yeah, the difference is that you can live without those things. You can't live without food.
Yeah.
Right? It's everywhere.
Yeah.
It's everywhere. And you need it. Your body needs it. Your body needs calories. So it is knowing your triggers and knowing what drives you to reach for those things and having the healthy things on hand. Because I can have one drink, I can have one margarita and put it down, but I know people who can't, and I know people who can have 2 Thin Mints and be done, and I cannot.
Whole box,
the whole box, right. And then I'm moving on to the dosey dose, because that's just I know that about myself, though. So you have to know what's your poison.
Yeah,
right?
Exactly.
What is
exactly.
it?
No, I really love that saying, though, because it's kind of like, because when I stopped drinking, it's like, oh, you can have just one. No, I really can't. Stop trying to pressure me.
Yeah,
I can't.
right.
But that's me, and so I know that. And it's worse with food too, especially if somebody spent like, all day cooking the meal, and they're like, oh, come on.
Right. Just taste it. Yeah. Just taste it. One bite won't kill you.
Yeah. I'm just like, well, actually it might. Or I've gotten to the point now where I'll say, yeah, the first one won't, but the 100 after that I'm going to eat secretly, those will probably get me.
Right.
But anyway, before we go to commercial, I wanted to pop up your website again. What can people find when they come and visit you here?
So on my website, you'll find more info than you probably ever want to know about myself. My health and wellness coach, RN, that works with me, our licensed clinical social worker, who's our mental health counselor, and our women's health practitioner, who's a certified nurse midwife. So you'll get to know all about us and where you can be seen if you like to be seen. We do telehealth as well. You can make appointments from that site. There's also links to other information if you're interested in digging deeper into anything. So.
I love that. I love that so much. All right. On that note, we do have to go to commercial break, so we'll be back in just a minute. Okay.
All right.
For those of you, let me try this again. Use your words, Julianne. For those of you who are watching us live, thank you so much. But like I said, we do have to go to a commercial break. So we'll be right back after these messages. Are you someone who is struggling to move forward because you suffered a loss? Maybe you're even finding it difficult to complete the most basic tasks. Are you looking for a way to start enjoying life again without feeling guilty or the resistance to do so? Spiritual life coach Sarah Stockham saw a need for people who haven't learned how to grieve without putting their entire lives on pause. And so she created a program that solves this issue called Choosing Life Right Now. This program is simple and you can do it on your own. If you are ready to learn how to feel your grief while still being able to smile, to honor the sacredness of what took place as a loss, and yet still continue to live with joy, and if you'd like to take care of your whole being with grace and love, then I'd like to invite you to experience her new program called Choosing Life Right Now. Sarah is currently offering her program for the promotional price of $77, but it won't stay at this price for long. To learn more, check out her website. The address is on the screen.
When drug or alcohol addiction take over, things begin to disappear. Your friends, your family, and eventually, you. Recommended by Dr. Phil, New Method Wellness can help get your life back with individualized treatment plans for dual diagnosis clients. New Method Wellness provides the most highly credentialed treatment in a safe and welcome environment. Call New Method Wellness for your free consultation and ask about our national accreditations. Together, we can put the pieces back together.
Welcome back, everyone. If you're just joining us now, today's guest is Erin Allen, and I don't even want to waste any more time. Let's bring her back on. She's like, oh, wait. I don't normally do that. Sorry. That was funny. But anyway, so, something was kind of on my heart, on my mind during the commercials, and I really want to ask you. So let's say somebody gets a cancer diagnosis, for example. How important is it? And would you say that? How important is your attitude about it?
So, attitude is everything, as they say, right?
Mm-hmm.
You really have to shift your focus in that. I think some people, when they hear a diagnosis like that, especially when we're talking about cancer, it's automatically it's a death sentence, right? Mm. They go into fight or flight mode, right? And they concentrate so much on not dying, that they really forget to live. Mm-hmm. Right? And so what's the point in not dying if you're not living?
Exactly.
Right? You're still here, right? Your friends are still here. Your family's still here. You're still here. I believe we're all on earth for a purpose. Mm-hmm. And so if you're still here, there's something for you to do. And, I think that, well, yes, see your oncologist, right? Make the medical choices that are best for you. Mm-hmm. Research and get second opinions and fight as hard as you need to fight, but never forget that you're fighting to live. You're not fighting to not die.
Exactly. No, that's really well said. There is a difference.
Yes, there's a very big difference.
There is. And, I actually had a guest on not that long ago who is a cancer thriver. She, I can't remember exactly, but anyway, she'll never be in remission for the rest of her life. There's no sign of it. So she's about as healthy as she can possibly be. But, it just made me think that other people would take that as I'm dying and then lay down and do so.
Right.
Yeah. It's kind of crazy how different people react. And, I don't know why I feel compelled to share this, so it must be important to somebody out there watching.
Sure.
But my mom, and I've shared this part before, but my mom had cancer and she passed away a long time ago. But she always told me that more people live with cancer than die from it, which I believed her. She didn't actually make it, but I still believe her. But the thing is, and this is what, I appreciated about her, is she had her own business. And she literally, and it was a bar, but she loved it. I mean, that for her was living. And she went in with her oxygen on and was working until the day she was admitted into the hospital. She worked that morning and was admitted into the hospital and passed away within 24 hours. And, they told her that she had, or they told us, not her, they told us because they put her, under to be comfortable, that, she'd probably be like that for a few months, but she ended up passing away within 24 hours. And I just remember thinking a couple things. One is, just because you're told something by a doctor or a health professional doesn't mean it is gospel. There is a chance for things to change, because as intelligent and well-educated and everything. There's so many other variables that are out there that, a doctor doesn't have a crystal ball.
No, absolutely not.
Take what resonates and leave the rest.
I actually have, quite a bit of background in palliative care and hospice. And I worked with a very wise nurse practitioner who told me once, and I won't call you out, Christine, but that she wished the whole world could be on hospice all the time. Let me explain that a little bit. When you're on hospice, you are kind of surrounded by care, right? Your provider comes to you, you get home visits, you get as much time as you need to talk about things. You have spiritual care and help. The chaplains come by, the social workers come by, right? And so it's a full, you have the nurses that come by and check on you, right? Everybody has physical and spiritual and emotional care when they're in hospice. And we don't have that in American healthcare until we get ready to die.
That
really feels wrong to me.
Yeah. That's really deep.
When I decided to expand my practice, that's instead of looking for, let's look for another, family nurse practitioner, et cetera. I decided, let's look for a coach. Let's look for a mental health provider, right? Let's bring on people who are spiritually focused, who will not judge or preach, but to sit with you where you're at and take that time and have that focus. And I think everybody deserves that. And I think it's wonderful that hospice patients have it. But why do we wait until then?
Exactly. And, that's the thing is that those people are available to be utilized while you're living too. And it's kind of like never using the good china.
Right. Right. Yes.
Today is a special occasion.
Right. Yeah.
You are alive today.
Special occasion is you woke up.
Yeah, exactly.
Right?
Yeah. Yeah. And you don't know this about me, but I've lost so many important people in my life. Rocks, shall we say, these like my mom and my brother, for example, that's just two. But the point is that, most people are like, oh, I'm so sorry. And well, there's two things. One, it's not about me. That was their time. That's what it is. All is in divine order, in my opinion. But the other thing is that it really showed me that I need to live while I'm alive. I need to live right now, because you don't know. Like waiting to take a vacation until I'm retired doesn't make sense, because I might not. What if another pandemic hits and I don't get to go anywhere?
Right.
You just never know. So I like that. I love that you do that, with your practice, because it's just all encompassing. And I feel like and correct me if I'm wrong, I kind of feel like when you take care of yourself in that way, in all aspects, somebody feels cared about, they're going to thrive.
Right.
I mean, as much as possible.
I think that, many times people feel better just in having been heard.
Yes.
I haven't really done anything for them yet, except, drawn the labs, and we're still in the process of researching things and formulating a plan, right? But they already feel better because they know somebody's in their corner.
Exactly.
Right? They know someone heard them.
Exactly. Listening, just, yeah. Yeah, that's amazing. I just, I'm so glad you're here today, because I just want everybody to realize what's possible, and that if they are not happy with who they're with right now, it doesn't mean that they have to stay there and grit their teeth. But Also, for somebody like my dad, for example, where he doesn't have a lot of options as far as medical professionals, if he wants those other things, he can go elsewhere and they can work together still, can't they?
Yes. Yeah. No, absolutely.
Yeah.
Absolutely. And, I don't accept commercial insurance. Lots of reasons for that, but one is that it really limits what I can do for patients when
Mm-hmm.
their insurance dictates what they will pay for and what they won't pay for.
Exactly.
It raises the cost all around,
Mm-hmm.
because taking commercial insurance means that I have to have someone to do billing and credentialing, and it creates this whole other quagmire of getting reimbursed for things, and it keeps the cost down for everybody if we just do direct primary care. So, and the cost for one of our visits isn't much more for most people than what their primary care copay is anymore, because copays are so high, and then on top of that, deductibles are so high, right? And people don't realize that you really do have a choice.
Mm-hmm.
Just because Cigna or United or Aetna says here's your list of primary care providers doesn't mean it has to be one of them, unless you're on an HMO plan, right? Which is again different. And honestly, I have patients like that too. I have patients that are Kaiser, right?
Mm-hmm.
So they have to see their Kaiser PCP, and guess what? They see them once a year for 5 minutes, and they draw their blood, and they go through that step, but they're still coming to us for real healthcare. Is what I call it.
Yes, no, it is healthcare. It's real healthcare.
Healthcare, I mean body, mind, and spirit together, treating the whole person. Exactly. And that's why I named my practice what I did. Cura Personalis means treat the whole person in Latin.
Oh, I was wondering.
It means treat the whole person. And so that's where the name came from. And so we're not just looking at the physical body. We're not just looking at mental health. We're not just looking at emotions. We're looking at how everything's working together to affect you as a whole.
I'm curious too, how often do you find that what is actually the cause of something is what, maybe Western medicine would consider completely unrelated? It's like not what you expect.
I very frequently find that the root cause of something is not what I expected.
Yeah.
Yes. Yeah.
I had it. Yeah. That was just kind of because I don't work in the same industry, I hate to use that term. That doesn't sound right. The same area of expertise. How about that? Same level. I was just, it seems like, especially because I personal train people, and I do nutrition coaching as well. So, usually when somebody comes to me with like an injury, for example, or, maybe lower back pain,
right,
a lot of the times it's like they need to stretch out their hamstrings to get rid of the lower back pain. It's never really, obviously it makes sense when you think about it, everything's connected, but it's so rarely what I, expect it to be, or what they expect it to be. Now it is what I expect it to be something different.
Right. And no, I find very frequently that, if we're just looking at those standard assessments, things that we do in primary care, like, the PHQ-9, for example, this is a screening for depression. If I went strictly by that, most of all of my patients will be on Prozac or Lexapro or Wellbutrin or something of that nature, right? But then when you talk about, okay, what really are these? Oh, it's fatigue. Okay. And you're not really having much motivation, and you've lost interest in, in your, what used to be your passions. Well, why is that? Are you in pain? What else is going on? Right. And so we frequently find that, especially with things like depression and anxiety, not to discount those at all. Those are real. Some people absolutely do need those medications. I'm saying that I very frequently find people misdiagnosed with depression and anxiety. I'm not saying it's not that. I'm saying it's not solely that.
Yeah.
That also, or contributory wise, have a thyroid problem, that also have an issue with their hormone levels, right? You have no libido, right? And you really, don't have much of a drive to do things in general, and you're feeling foggy headed, and you're just feeling kind of down. Some people would say, well, that's depression. Well, yeah, technically it is, but what's causing it? the fact that your hormone tank is, right? You have no testosterone, you have no estrogen, you have no, right? So we have to look at, like, what are we missing here? What can we treat or organically, and the root cause of things, to get people, really to the best that their body can function.
Yeah.
And then if it hasn't helped the depression symptoms enough, then we look at, the Prozac or Lexapro, things like that.
Exactly. And, it's, I'm coming back to this whole thing. Like, you're mentioning all these symptoms, and I had those or have those because of something else. And,
Right.
But it's so easy to misdiagnose if you're not really looking at everything. So I appreciate that, because, I remember too, a long time ago, I was speaking with a psychiatrist, and I said, because I was on antidepressants and anti-anxiety medication. I said, I don't really want to be on these, and, so I would like to taper off. And he starts asking me these weird questions and things like, do you have dreams about your teeth falling out? And I said, no. And he goes, oh, that's too bad. I'm like, what?
Yes.
He really wanted me to be bipolar so that he could medicate me. And he said that. He said it would be so much easier, you might be. And he was just like, okay, I'm never
it's
going
always
to see you.
easier just to medicate people.
Yeah, I'm just like, I will never, and I never did.
Resistance, isn't it?
It was so crazy.
Write the prescription. Done. Right?
I know. And he was like excited about it. And I just thought, okay, psycho. Needless to say, that was a one and done visit.
Okay. I was going to say, I hope you didn't see him for that much longer. Okay.
No, I was like, oh no, no way.
Probably a good choice. Good choice.
Exactly. But that's the whole point, is, listening to yourself and what works for you. Like, I think that sometimes and correct me if I'm wrong too, you don't have to throw the baby out with the bathwater. It's not necessary that you change primary care physicians and, all the time.
No.
Try communicating. But sometimes, that crazy psychiatrist, I was just, nope.
And you know what? I actually get referrals from other primary care providers all the time.
I love
and
that.
We're working together.
Yeah.
It's
I
not,
love that.
It's a consult, right? It's, here, this practice does things my practice can't do. Why don't we go see them? But I'm still not completely taking over their care. They're still their primary care provider, right?
Exactly.
We can all work together to help people. It doesn't need to be, oh, well, that's your patient and this is my patient. That's just not how things should work.
No, it's not like the police where they get territorial.
But people do, and they get really defensive about, oh, well, I'm not going to refer to her because then she's going to take my patient.
Yeah.
That's not really my intention, right? If I wanted to see 40 patients a day, I would still be working for the big physician group that I worked for prior to working here, right? I would still be, on the road to weight gain and burnout and, other high stress symptoms like, diabetes and chronic migraines and issues like that. I would still be doing it if that's what I wanted.
Yeah.
But what I really want to do is to help people to live their best. And, that goes for other healthcare providers too. I think there are a lot of providers that are really stuck in this hamster wheel with, commercial insurance. And there is a place for commercial insurance. I'm not saying go drop your insurance, please. Don't say that I'm saying that, right? If, heaven forbid that you get cancer or you have a horrible car accident or, we just don't know. For emergency medicine and major diagnoses like that, of course, we still need health insurance. That's not what I'm saying. What I'm saying is that we can do primary care so much better for the patient and for the provider, right? So I have a book coming out in the fall about this very thing. It's called Broken Healthcare, Broken Healers. And it's geared toward other medical providers, physicians, nurses, nurse practitioners, PAs, even, the physical therapists,
Mm-hmm.
people who are just caught in this loop. And it's really about how to break free from that stress cycle, and what you can do or look for, or the changes you can make in your own system. And if you can't make those changes, what changes can you make yourself to help to deal with that burnout issue? We are losing providers at a rapid rate. We are losing nurses at a rapid rate. We're losing physicians at a rapid rate.
Mm-hmm.
We have nurse practitioners, come out of 8 years of school and work for a year and say, forget this isn't what I thought it was going to be, and then leave. Because the system chews people up and spits them out.
Yeah.
So it's really geared toward those health providers and surviving that system. But I think that even if you're not in that healthcare setting, that it would be a real eye-opener for most patients to know what their providers are going through.
Exactly. And I think that is a really important perspective to have, because I think a lot of people don't really understand. And it's kind of like putting the doctor up on this pedestal that's impossible, first of all, to stay up there. I don't care who you are.
Yeah.
But also to understand, like, maybe that's why they're making or saying these choices, and to have empathy when,
Right.
maybe they only do have those 5 minutes to talk to you.
Right. I'm sure they would love to spend all day with patients. I mean, when I was stuck in that system, I would have loved to have spent an hour with most of my patients. I didn't have the freedom to do that. And
Exactly.
So I finally broke free and started my own practice, and now I have the freedom to do that. I'm very lucky. I had, help and support along the way in doing that, but not everybody does. And some people have to work within their system. And so how do we make that work without harming yourself?
Exactly. Well, we really only have about 1 minute left. Is there any final thoughts? I know it sneaks up real quick.
Final thought, I would say to people looking to keep healthy and stay healthy and partner with their providers, be your own advocate. Don't be afraid to say what you need. And if you're not being heard, find someone who will hear you.
I love that.
Yeah.
And just for everybody who's watching, here's the website, and the book is coming out in the fall, correct?
Yes, it's coming out in the fall.
I am really excited to read that. I think it's going to be fascinating.
Yeah, I'll keep it posted. It'll be on my Facebook and Instagram, which is the same handle as the website, by the way. Cura Personalis IH, Cura Personalis Integrative Health.
There we go.
So Facebook, Instagram, it's all the same.
Perfect.
So easy to find. Yeah.
Yay. No, and I love that. And that's such a perfect name too. That's amazing.
I have to repeat it a few times for people sometimes. and I've wondered over the last year and a half since I've been open, like, was that a really smart thing but it just fits my mission so perfectly.
Exactly. And people will remember. So, and it goes up at the top because not everybody has it. So
right.
Anyway, Erin, I just want to say thank you so much for being on the show today. It's been an absolute pleasure.
Well, thanks, Julie. It was fun. Anytime.
Awesome. I'll see you again. I'll see you soon, actually.
I'll see you soon. All right. Take care.
Bye. Unfortunately, that is all the time that we have for today. So enjoy the rest of your week, everyone, and we will see you next time.